how shall the Tiffany ABA narrow ESV yeah, yeah, the my God, the wolf, what is the visible land of the wolf available is a the oh my oh the
Applied behavior analysis, not to be confused with discrete trial training, a teaching technique that is a form of the broader discipline of applied behavior analysis. Applied behavior analysis, ABA, also called behavioral engineering, is a scientific technique concerned with applying empirical approaches based upon the principles of respondent and operant conditioning to change behavior of social significance. It is the applied form of behavior analysis. The other two forms are radical behaviorism, or the philosophy of the science, and the experimental analysis of behavior, or basic experimental research. The name applied behavior analysis has replaced behavior modification because the latter approach suggested attempting to change behavior without clarifying the relevant behavior-environment interactions. In contrast, ABBA changes behavior by first assessing the functional relationship between a targeted behavior and the environment. Further, the approach often seeks to develop socially acceptable alternatives for aberrant behaviors. ABBA has been utilized in a range of areas, including applied animal behavior, school-wide positive behavior support, classroom instruction, structured and naturalistic early behavioral interventions for autism, pediatric feeding therapy, rehabilitation of brain injury, dementia, fitness training, substance abuse, phobias, tics, and organizational behavior management. ABBA has been subject to controversy. The Guardian reports that critics within the autism rights movement have likened the approach to dog training due to its history of using aversive, such as electric shocks, to change children's behavior. Ari Naiman, president of the Autistic Self-Advocacy Network, claims that ABBA has a predatory approach to parents. Dr. Liz Pellicano, head of the Center for Research in Autism and Education at the Institute of Education, University of London, says that the underlying ideology of ABBA, to make autistic children indistinguishable from their peers, as opposed to accepting their differences, is ethically questionable and potentially harmful. Contents. 1. Definition. 2. History. 3. Characteristics. 3.1 Other proposed characteristics. 4. Concepts. 4.1 Behavior. 4.2 Reinforcement. 4.3 Punishment. 4.4 Extinction. 4.5 Discriminated operant. And the beginnings of ABBA can be traced back to Teodoro Ione and Jack Michael's study, The Psychiatric Nurses, a Behavioral Engineer, 1959, that they published in the Journal of the Experimental Analysis of Behavior, JEAB. Ione and Michael were training the staff and nurses at a psychiatric hospital how to use a token economy based on the principles of operant conditioning for patients with schizophrenia and intellectual disability, which led to researchers at the University of Kansas to start the Journal of Applied Behavior Analysis, JABA, in 1968. A group of faculty and researchers at the University of Washington, including Donald Baer, Sidney W. Bijou, Bill Hawkins, J. Brunbauer, Ty Risley, and Montrose Wolfe, applied the principles of behavior analysis to instruct developmentally disabled children, manage the behavior of children and adolescents in juvenile detention centers, and organize employees who required proper structure and management in businesses, among other situations. In 1968, Baer, Bijou, Risley, Bernbauer, Wolfe, and James Sherman joined the Department of Human Development and Family Life at the University of Kansas, where they founded the Journal of Applied Behavior Analysis. Notable graduate students from the University of Washington include Robert Waller, James Sherman, and Ivara Lovas. Lovas established the UCLA Young Autism Project while teaching at the University of California, Los Angeles. In 1965, Lovas published a series of articles that outlined his system for coding observed behaviors, described a pioneering investigation of the antecedents and consequences that maintained a problem behavior. The experimental group in this study received an average of 40 hours per week in a one-to-one teaching setting at a table using errorless discrete trial training (DTG). The treatment is done at home with parents involved in every aspect of treatment, and the curriculum is highly individualized with a heavy emphasis on teaching icon-intensive behavioral treatment. Lovaas' work went on to be recognized by the U.S. Surgeon General in 1999, and his research were replicated in university and private settings. Lovaas' method went on to become known as Early Intensive Behavioral Intervention (EIBI), or 30 to 40 hours per week of DTT. The original Lovaas method focused heavily on the use of aversives, utilizing shocks, beating children, ignoring children, withholding food, etc. Using shocks, ignoring children, withholding food and toys, and spraying children with water are still used today and considered ethical by the Behavior Analyst Certification Board (BACB). Another criticism of the Lovaas method is Lovaas's connection with gay conversion therapy, using his own behavior modification techniques seen in AAC and the Feminine Boy Project. Similarities in gay conversion therapy to making boys indistinguishable from their heterosexual peers have been drawn. Characteristics. Edit. Bear, Wolf, and Risley's 1968 article is still used as the standard description of conceptually systematic behavior analysis should not simply produce a list. Applied ABBA focuses on the social significance of the behavior studied. For example, a non-applied researcher may study eating behavior because this research helps to clarify metabolic processes, whereas the applied researcher may study eating behavior in individuals who eat too little or too much, trying to change such behavior so that it is more acceptable to the persons involved. Behavioral ABBA is pragmatic. It asks how it is possible to get an individual to do something effectively. To answer this question, the behavior itself must be objectively measured. Verbal descriptions are treated as behavior in themselves and not as substitutes for the behavior described. Analytic behavior analysis is successful when the analyst understands and can manipulate the events that control and target behavior. This may be relatively easy to do in the lab, where a researcher is able to arrange the relevant events, but it is not always easy or ethical in an applied situation. Bear et al. Outline two methods that may be used in applied settings to demonstrate control while maintaining ethical standards. These are the reversal design and the multiple baseline design. In the reversal design, the experimenter first measures behavior of choice, introduces an intervention, and then measures the behavior again. Then, the intervention is removed or reduced and the behavior is measured yet again. The intervention is effective to the extent that the behavior changes and then changes back in response to these manipulations. The multiple baseline method may be used for behaviors that seem irreversible. Here, several behaviors are measured and then the intervention is applied to each in turn. The effectiveness of the intervention is revealed by changes in just the behavior to which the intervention is being applied. Technological. The description of analytic research must be clear and detailed so that any competent researcher can repeat it accurately. Cooper et al. Describe a good way to check this. Have a person trained in applied behavior analysis read the description and then act out the procedure in detail. If the person makes any mistakes or has to ask any questions, then the description needs improvement. Conceptually systematic behavior analysis should not simply produce a list of effective interventions. Rather, to the extent possible, these methods should be grounded in behavioral principles. This is aided by the use of theoretically meaningful terms such as secondary reinforcement or errorless discrimination where appropriate. Effective though analytic methods should be theoretically grounded, they must be effective. If an intervention does not produce a large enough effect for practical use, then the analysis has failed. Generality. Behavior analysts should aim for interventions that are generally applicable. The methods should work in different environments, apply to more than one specific behavior, and have long-lasting effects. Other proposed characteristics. Edit. In 2005, Heward et al. Suggested that the following 5 characteristics should be added. Accountable. To be accountable means that ABA must be able to demonstrate that its methods are effective. This requires the repeatedly measuring the effect of interventions, success, failure, or no effect at all, and, if necessary, making changes that improve their effectiveness. Public. The methods, results, and theoretical analyses of ABA must be published and open to scrutiny. There are no hidden treatments or mystical, metaphysical explanations. To be generally useful, interventions should be available to a variety of individuals who might be teachers, parents, therapists, or even those who wish to modify their own behavior. With proper planning and training, many interventions can be applied by almost anyone willing to invest the effort. Empowering. ABA provides tools that give the practitioner feedback on the results of interventions. These allow clinicians to assess their skill level and build confidence in their effectiveness. Optimistic. The behaviors impacted by behavior analysis are largely determined by learning and controlled by manipulable aspects of the environment. Practitioners can improve performance by direct and continuous measurements. As a practitioner uses behavioral techniques with positive outcomes, they become more confident of future success. The literature provides many examples of success in teaching individuals considered previously unteachable. Concepts. Edit. Behavior. Edit. Main article. Behavior. Thinning a reinforcement schedule. Edit. Thinning is often confused with fading. Fading refers to a prompt being removed, where thinning refers to an increase in the time or number of responses required between reinforcements. Periodic thinning that produces a 30% positional prompt, e.g., the target item is placed close to the individual. Modeling the desired response. A prompt is a cue that is used to encourage a desired response from an individual. Prompts are often categorized into a prompt hierarchy from most intrusive to least intrusive, although there is some controversy about what is considered most intrusive. Those that are physically intrusive are those that are hardest prompt to fade, e.g., verbal. In order to minimize errors and ensure a high level of success during learning, prompts are given in a most to least sequence and faded systematically. During this process, prompts are faded as quickly as possible so that the learner does not come to depend on them and eventually behaves appropriately without prompting. Types of prompts. Prompters might use any or all of the following to suggest the desired response. Vocal prompts. words or other vocalizations.
No.
Visual prompts, a visual cue or picture. Gestural prompts, a physical gesture. Positional prompt, e.g., the target item is placed close to the individual. Modeling the desired response. This type of prompt is best suited for individuals who learn through imitation and can attend to a model. Physical prompts, physically manipulating the individual to produce the desired response. There are many degrees of physical prompts, from quite intrusive, e.g., the teacher places a hand on the learner's hand, to minimally intrusive, e.g., a slight tap. This is not an exhaustive list of prompts. The nature, number, and order of prompts are chosen to be the most effective for a particular individual. Baiting, edit. The overall goal is for an individual to eventually not need prompts. As an individual gains mastery of a skill at a particular prompt level, the prompt is faded to a less intrusive prompt. This ensures that the individual does not become overly dependent on a particular prompt when learning a new behavior or skill. Thinning a reinforcement schedule, edit. Thinning is often confused with fading. Fading refers to a prompt being removed where thinning. Behavior analysts have spent considerable amount of time studying factors. Some of the interventions that result from this type of conceptualization involve training specific communication skills to replace the problem behaviors, as well as specific setting, antecedent behavior, and consequent interventions based on an FBA, edit. Critical to behavior analytic interventions is the concept of a systematic behavioral case formulation with a functional behavioral assessment or analysis at the core. This approach should apply a behavior analytic theory of change. See behavioral change theories. This formulation should include a thorough functional assessment, a skills assessment, a sequential analysis, behavior chain analysis, and ecological assessment. A look at existing evidence-based behavioral models for the problem behavior, such as Fortis's model of chronic pain, and then a treatment plan based on how environmental factors influence behavior. Some argue that behavior analytic case formulation can be improved with an assessment of rules and rule-governed behavior. Some of the interventions that result from this type of conceptualization involve training specific communication skills to replace the problem behaviors, as well as specific setting, antecedent behavior, and consequence strategies. Used in the treatment of autism spectrum disorders, edit. This article contains weasel words, vague phrasing that often accompany. ABA-based techniques are often used to teach adaptive behaviors or to diminish behaviors associated with autism, so much that ABA itself is often mistakenly considered to be synonymous with therapy for autism. According to a paper from 2007, it was considered to be an effective intervention for challenging behaviors by the American Academy of Pediatrics. A 2018 Cochrane review of 5 studies that compared treatment versus control showed that ABA may be effective for some autistic children. However, the quality of the evidence was weak. The number of subjects in the studies was small, and only one study randomized subjects into control and treatment groups. The effectiveness of ABA treatments for autism may be overall limited by diagnostic severity, age of intervention, and IQ. Efficacy, edit. 2007 to 2009 reviews of the efficacy of ABA-based techniques in autism include, edit. A 2007 clinical report of the American Academy of Pediatrics concluded that the benefit of ABA-based interventions in autism spectrum disorders (ASDs) has been well documented, and that children who receive early intensive behavioral treatment have been shown to make substantial sustained gains in IQ, language, academic performance, and adaptive behavior, as well as some measures of social behavior. 2008, researchers from the Mind Institute published an evidence-based review of comprehensive treatment approaches in 2008. On the basis of the strength of the findings from the on the basis of these and other studies, the author concluded that ABA is well established and is demonstrated effective in enhancing global functioning in preschool children with autism when treatment is intensive and carried out by trained therapists. However, the review committee also concluded that there is a great need for more knowledge about which interventions are most effective. A 2009 paper included a descriptive analysis, an effect size analysis, and a meta-analysis of 13 reports published from 1987 to 2007 of early intensive behavioral intervention (EIBI), a form of ABA-based treatment with origins in the lung. Furthermore, any improvements are likely to be greatest in the first year of intervention. A 2009 meta-analysis, Spreckley and Boyd. Furthermore, the four studies authors raised the possibility that Spreckley and Boyd had excluded some other studies unnecessarily, and that including such studies could have led to a more favorable evaluation of ABI. Spreckley, Boyd, and the four studies authors did agree that large multi-site randomized trials are needed to improve the understanding of ABA's efficacy in autism. 2010 to 2019 reviews of the efficacy of ABA-based techniques in autism include, edit. In 2011, investigators from Vanderbilt University under contract with the Agency for Healthcare Research and Quality performed a opposition to the use and treatment of autism spectrum disorder, edit. See also, Autism Rights Movement, Autistic Community, edit. The value of eliminating autistic behaviors is disputed by proponents of neurodiversity, who claim that it forces autistics to mask their true personalities on behalf of a narrow conception of normality. Autism advocates contend that it is cruel to try to make autistic people normal without consideration for how this may affect their well-being. Instead, these critics advocate for increased social acceptance of harmless autistic traits and therapies focused on improving quality of life. A recent study examined perspectives of autistic adults that received ABA as children and found that the overwhelming majority reported that behaviorist methods create painful lived experiences. That ABA led to the erosion of the true actualizing self, and that they felt they had a lack of self-agency within interpersonal experiences. Professional concerns, edit. Professionals against ABA have voiced concerns over its evolution from radical behaviorism. Radical behaviorism, when applied, views the individual as nothing more than Radical behaviorism, when applied, views the individual. Professional concerns. Edit. Professionals against ABBA have voiced concerns over its evolution from radical behaviorism. Radical behaviorism, when applied, views the individual as nothing more than a stimulus response. That all of their experience can be reduced to a set of behavioral functions and manipulated through operant conditioning, which only addresses the surface level and may only temporarily subdue aggressive behavior under the guise that it is addressed because the subject appears content. Other concerns have focused on the ideological warfare surrounding ABBA and TEACCH, despite the philosophies and practices of the two approaches not ever being shown to be in opposition. The rhetoric surrounding the virtues of ABBA has concerning effects, including parents and professionals that claim that ABBA cured their child's autism. Like one parent who claims that ABBA had saved her children's lives, likening it to chemotherapy as a treatment for cancer. Researchers have critiqued the leniency of the ABBA ethical code, discussing how it does not restrict or clarify the appropriate use of aversives. It does not require competency, so ABBA therapists are not required to take even a single class on autism, brain function, or child development. And its view of the client as the parent, so requiring client consent only requires parental consent, not the person receiving services. Similarly, because the parent is seen as the client, the goals that are set under the ethical code are according to the client's needs, which means focusing on changing autistic behaviors for the benefit of the parent and not the child is considered ethical. Besides ethics, scientists also have concerns over methodological issues through the evidence for the use of ABBA on autistic children. Early ABBA research regularly employed poor methodology, including the initial study by Lovas that supposedly supported the use of the therapy. Many studies did not randomize and polled subjects from researchers' own clinics, and obtained funding by ABBA organizations with a clear conflict of interest for proving ABBA is effective. Another concern is that ABBA research only measures behavior as a means of success, which has led to a lack of qualitative research about autistic experiences of ABBA. A lack of research examining the internal effects of ABBA, and a lack of research for autistic children who are non-speaking or have comorbid intellectual disabilities, which is concerning considering this is one of the major populations that intensive ABBA focuses on. Research is also lacking about whether ABBA is effective long-term, and very little longitudinal outcomes have been studied. RBT, Registered Behavioral Technician. Some embodiments of applied behavior analysis is devised by Olive Lovas used aversives such as electric shocks to modify undesirable behavior in their initial use in the 1970s, as well as slapping and shouting in the landmark 1987 study. Over time, the use of aversives lessened, and in 2012 their use was described as being inconsistent with contemporary practice. However, aversives have continued to be used in some ABBA programs. In comments made in 2014 to the U.S. Food and Drug Administration (FDA), a clinician who previously worked at the Judge Rodenberg Educational Center, claimed that all textbooks used for thorough training of applied behavior analysts include an overview of the principles of punishment, including the use of electrical stimulation. In 2020, the FDA banned the use of electrical stimulation devices used for self-injurious or aggressive behavior and asserted that evidence indicates a number of significant psychological and physical risks are associated with the use of these devices, including worsening of underlying symptoms, depression, anxiety, post-traumatic stress disorder, pain, burns, and tissue damage. Major journals. Edit. Applied behavior analysts publish in many journals. Some examples of core behavior analytic journals are Journal of Applied Behavior Analysis, Journal of the Experimental Analysis of Behavior, Behavior Analysis Research and Practice, The Behavior Analyst Today, Perspectives on Behavior Science, formerly The Behavior Analyst until 2018.
Things event to me are real and knowing the from back the ever